next week we had 17 died. The following week we had 28 to die. That was just a lot of people just dying that you know.
Dougherty County Coroner Michael Fowler describing the first few days of the pandemic and the massive toll it took on Albany. On this day, 5 years ago, the World Health Organization declared COVID-19 a pandemic. Social distancing, wearing masks, and isolation became our new normal.
Close to 150 million cases of the virus have been reported in America, with close to 1.2 million people dying from the disease. Dougherty County was considered an early hotspot for the virus.
Like other hospitals across the country, Phoebe was not prepared for the crisis at home.
As of right now, you still have to wear a mask and practice social distancing.
City leaders say they are working constantly on ways to combat this virus and lower the number of positive cases.
This is an evolving situation. There are no textbooks to go to learn about COVID-19.
There will be much to learn from this event, and we know we are forever changed because of it.
We need to be prepared locally, and that's how we kind of, we're embracing the idea that it may happen here, never really thinking that we were going to be one of the early entrants into the pandemic.
Months before coronavirus became a concern in the U.S., Dr. James Black, director of emergency medicine at Phoebe, and head officials began taking stock and getting prepared.
You just never saw the peak. You were always hoping it was going to peak, but it never did. But I don't think any of us could have imagined that it was going to be as devastating as it was and as widespread as it was.
Dougherty County was one of the worst COVID-19 hotspots in the nation. The initial outbreak was linked to a 67-year-old man who didn't know he had COVID when he attended a funeral at Martin Luther King Funeral Home Chapel in Albany. That night, the man was admitted to Phoebe after experiencing shortness of breath.
There were a lot of reasons why he would have been short of breath, and it was also flu season. So there were a lot of other things other than COVID, and at that time, we couldn't even test for COVID.
A few days later, the man would be transferred to Atlanta and tested positive for COVID-19 and died on March 12th, marking the state's first coronavirus death. When did it really sink in for you that, okay, this is getting serious?
I think that news is kind of, like you said, we were waiting to hear, but we kind of in the back of my mind as things started to evolve knew. And at the same time, we started seeing more and more patients locally. So I think we knew, but that was the first real hit in the face that this is here and it's deadly.
Sick patients began pouring into the ER. Within a month, hundreds became sick and dozens of people died. Dougherty County Coroner Michael Fowler says it got to a point where they stopped counting the number of deaths.
So in a sense, it was like a bombshell dropped that day. I mean, the next week we had 17 died. The following week we had 28 to die. That was just a lot of people just dying that you know.
Fowler and Dr. Black have worked a number of crises, but both agree they've never seen anything like this before, especially something that hits this close to home.
I didn't know those individuals, but being able to come to people's houses that you knew, you worked with your co-workers, your family. I had families that died from it. So these individuals that you know locally, that you've been around, and you had to zip them up in a body bag. It was more touching, but just because they was here just yesterday.
The pandemic put a strain on the frontline workers and medical supplies. Phoebe employees made homemade masks and face shields because the hospital went through a 6-month stockpile of PPE supplies in a matter of weeks.
I think one of the things we learned was early community involvement, being very transparent with what we're dealing with, asking for additional aid and resources early on is critical.
And Dr. Black also wants to appreciate the community's involvement, who he says was involved in the response, and they wouldn't have been able to manage as well as they did without you all at home. And so there again, we know that once this virus spread, they're looking at it as how Phoebe was kind of the foundation of getting people in and you know, just really managing, like he said, that virus. He got an overwhelming amount of calls from other hospitals once it started to spread. Also, Dougherty County Coroner Michael Fowler, he was saying the same thing. He was getting overwhelmed by the amount of calls he received from coroners around the world saying, hey, how are you doing this? But it's just hard to believe 5 years ago.
5 years ago,
5
and I
years
do
ago.
remember we lost many of our friends during that time. But I remember one Saturday morning getting the call that a dear friend had passed away, and it was because of COVID.
Yeah.
And I mean, it just sort of was very much an eye-opener about how viruses can spread, and the fear, there was fear, because we didn't know really what was going on.
Yeah.
So.
And Dr. Blake is also saying to watch out, and they're doing the same for these other viruses and variants that are popping up. Remember to wash your hands and use those safety precautions. So definitely something great to keep in mind.